I'm going to have IT come and try to figure out. Was that your feed that was causing the problem?
Done.
Okay, Ms. Boland, can you hear us? Ms. Boland,
Yes,
can you
I
hear
can.
us? Great,
Yes, I can.
great.
Judge, before we start, well, I guess you're not have to, we can worry about this. Well, I guess you're not have to, we can worry about this. There's a series of texts. There's a series of texts moving into evidence, but moving into evidence. Well, I guess you're not have to, we can worry about this afterwards. We can do that.
Judge, I
There's a
don't know
series
anything
of texts
Judge, I don't know anything
that we're
about
going to be
series of texts.
moving into evidence, but,
The same, yes.
and only the
yes.
parts by, and only the parts by responses. No, I don't have an exception for the responses. I don't have an exception for the responses.
Well, this is your, proffer, so, Ms. Boland, hold on a second. I think we figured it out. We're getting reverb on, we're running Zoom, but I think Mr. Reyes figured it out.
We're good. I just switched audio inputs. I popped out of yours and popped into mine. It's done.
Well, she can hear me. Can you put something up? Are you able to still broadcast? Share screen?
Let me attempt to share, Your Honor, with your permission.
Yes.
Let me set this here so I can see.
Well,
Host
actually,
disabled
we're turning this TV
participant.
on.
We just need you to provide me with privileges to share, because it's currently disabled by the host.
This is.
Oh, great. Ready for that monitor for you.
Oh. You see him roll it in.
Mike, where would I find that? It's not there.
Share screen.
Maybe that's it right there. Now try that.
Yes, Your Honor. Sharing.
Ms. Boland, can you see that?
Yes, I can.
Okay, great. Let's go ahead and take it down.
Yes, sir.
Will there be audio as well, or that's where I'm concerned?
It's only visuals,
Okay.
no audio files.
Thank you.
Let's take the share screen down, please.
Yes, sir. Just a moment.
Now, Ms. Boland, are you currently in the state of Florida?
No, I'm in North Carolina.
Okay. Under our rules, either you need to have somebody there to swear you in, or you can consent for me to do it. But understand, by me consenting, or by you consenting, you are actually agreeing to jurisdiction here in Sarasota County, Florida, if there was ever any type of, Mr. Reyes, your screen's still on.
Just press it. Yeah, press the big part of the green.
That's not me, that's somebody else.
There we go. Okay. So, Ms. Boland, if there was ever any type of enforcement action or perjury action that would actually occur here in Sarasota County, Florida, and you are consenting to jurisdiction here in Sarasota County, Florida, and under that understanding, do you agree that I can swear you in?
Yes, sir.
Please raise your right hand. Do you solemnly swear or affirm the testimony you give is the truth?
Yes.
Okay, go ahead and lower your hand. Okay,
May I
Mr.
have
Anderson,
her
you
on
may
the-
inquire.
Thank you, Judge. May I have her on the larger screen, or do you want it like that?
That's how I'm going to leave it.
Okay. Please state your name for the record.
Megan Boland.
All right, Ms. Boland, this is what's known as a proffer, where I'm going to ask you questions out of the sight and sound of the jury so that the court can hear your responses prior to your testimony before the jury. Where do you live?
Elizabeth City, North Carolina.
How long have you lived there?
A little over a year.
Where are you from originally?
Colorado.
Okay. And what do you do for a living?
I am a special education teacher.
And where are you a special education teacher?
I am the department chair and sixth grade EC teacher at Elizabeth City Middle School.
Okay. How long? Well, a little over a year then. You've been
A little over a year.
Okay.
Yep.
Where'd you live before that?
We lived in Lone Tree, Colorado and Highlands Ranch, Colorado.
Okay. So Colorado, North Carolina.
Yep.
All right. I'm going to jump to the essence of this. How did you first get to know Beata Kowalski?
My son started a nonprofit when he was 10 years old, and I've been running it ever since. And I run our parent support groups.
Okay. And what is this for?
My son has complex regional pain syndrome, and he started Ferocious Fighters to make sure other kids didn't have to feel as alone as he did.
Okay. And so it's your sons, though, that started it, and
Yes.
but you help every once in a while, I take it. Okay.
I basically run it. He's now 19 and college age. So
Yes.
I'm running it for a long time.
He has more priorities. Okay. So you sent her a care package of what?
So we send out a couple of things. Once a family finds us, we send out a welcome package that has a scarf and cards and ways to get connected, as well as a awareness band. And then when we are able to raise enough funds to get to them, we send out a bigger care package that has a blanket and a t-shirt and a whole bunch of things, a notebook for them to journal in and a keychain. When Patrick was designing the products, the focus was on a mixture of spreading awareness and being more visible, because they felt like people couldn't see their disability and their challenges, and they weren't taken seriously.
Okay. Yeah, we're going to need to try to keep our answers as brief
All right.
as we can. I know. It's first. This is your first time ever testifying?
Second.
All right. And so you've already talked about that you have a son with this. So you're familiar with CRPS?
Yes.
All right. So when was the first time you started to talk or text with Beata?
I believe it was around October of 2016.
Okay. But let me show you then, with a refresh your recollection, and actually I'll eventually move this in. It's Trial Exhibit 2781-006 and 007, if we can screen share that.
Just a moment.
Just a little technical issue. We'll be right there. Okay. Would you note the dates on that?
October 30th, 2016.
And above that,
July 16th, 2016.
does that refresh your recollection of perhaps the first time that you had any contact?
Yeah, we must have been talking for more than a couple of years.
Okay.
So it probably would have been a full year prior, because I know that that she had sent a message to our board first, like our board of directors page on Facebook, and I connected with her through there.
Okay. And so over the course of 2016, did you correspond and or talk to Beata Kowalski frequently?
Yes, between the group and occasional messages one-on-one, we spoke and interacted pretty frequently.
When Maya was, when Beata was texting you, would she often give you updates?
Yes.
What was happening? And was she reciting her recollection of what was going on immediately right then with Maya?
It seemed like she was, yes.
And did she discuss in there Maya's pain or other medical condition?
Yeah, we would often talk about what was going on with Maya and the challenges she was having with her CRPS.
Okay, I have a second trial exhibit 2781-012. And if we can bring that one up. That's 2781, 012, and 013. While they're doing that, if you don't mind, Your Honor, may I read, since the jury's not here, may I just read it?
That's fine.
This is November 17th, 2016 at 8:05 p.m. She's depressed, DT, I don't know what DT is, isolation from her family and friends, bored from being in the hospital for 5 weeks. Her dystonia to feet, legs is progressively getting worse. She's getting weaker all over. She can't pull up her shorts or zip up her shorts anymore. She cannot pick up her right leg up to the knee anymore. It jumps then. She says she's hurting a lot, but no one is doing anything about it. One of the MDs told Jack the, quote, psych is working on the pain in her legs. Can you believe this stuff? Do you recall that now, having heard it?
Yes.
At this point, in November of 2016, that would make it approximately 2.5 months prior to her taking her life. Can you tell us whether you were in phone conversations as well?
I know that we wound up talking on the phone shortly after my son was in the hospital, but I don't know if it was by this date or just before it, because we were dealing with dystonia issues as well in Colorado.
Okay. And so in those conversations, did Beata express to you, again, what her state of mind was, and how she was feeling about what was happening to her?
Absolutely. I mean, she was heartbroken and desperate to figure out how to make it stop for Maya.
All right. And if we've got it up, I just read it to you. And was it your sense, strike that, have you ever actually met, before she took her own life, did you ever actually meet Beata Kowalski in person?
We did not. The one time we were down in Florida, they weren't available to come meet us.
All right. So your knowledge of her is based on I guess these are texts, and your phone calls with her. Is that
Facebook messages and phone calls, yes.
And over the course of let's say 6 months prior to her taking her life, which would put you back in June or July of 2016, approximately how many times do you believe that you called her or she called you?
My guess would be 6 or 7.
Okay. Did it turn out that you were the last person to speak with her before she took her own life?
I don't know if I was the last.
I don't know if I need to place objections on the proffer, Judge.
Okay. Well, I'm going to allow the question
Okay.
for the proffer.
Okay.
I don't know if I was the last, but I did speak with her the night before.
Okay. Over the course of this time, did you notice whether Beata was changing, if you will, in her view of life, her view of the situation?
The longer it went on, the more upset she obviously was, and the more hopeless she became that it would ever change.
Okay. So by November, sending this text 2781-81, sorry, 2781-012 and 013. Around this time, would you have had a phone conversation with her?
Just right around that time, because Patrick was in the hospital in November for a period of time. So we spoke shortly after he got out of the hospital. So it would have been either right before this or right after it.
Again, how did her voice sound, and from what you could tell over the phone, her demeanor?
I mean, she was in tears. So she was upset and just could not figure out what to do to make it stop.
And so then let's move to trial exhibit 2781-014 and 15. We could pull those up. And they're already up. Good. All right. If you could read that to yourself, or I can read it out loud for everyone. You are absolutely right. They thought I was making her sick. I guess not. She's still sick.
Mr. Anderson, we can all read it.
Yes, sir. Let me know when you read it.
I've read it.
Okay. Now, at around this time, November 17th of 2016, again, when you got an email like this, would it be your pattern and practice to have a phone call with Beata?
We would usually talk on the phone, yes.
And if you can recall the calls after this particular one where she's describing what she believes is the plan over at Johns Hopkins, can you tell us again what you could tell about her demeanor and her state of mind from her voice?
She was angry, and she was sad, and she was desperate. I don't know how else to say that. Like, she just was really, truly upset and had no idea what to do to help her daughter.
Hope. Was it your sense from the conversation and the text that Beata was giving up hope?
She definitely was feeling more hopeless. I mean, she was doing everything she could, hiring lawyers and spending all of their money. You could tell that there was, stress there, to try to just get their daughter back and get her some care.
All right. And so then, and there may have been other texts, but we'll just talk about those right now. The day or evening of January 7th, 2017, do you recall having a phone call with Beata?
Yes, I do.
And was there any purpose to the call? Strike that. Did you call her or she call you, if you recall?
I think she called me.
Okay. And how did she describe what her state of mind was over the phone?
She just said that they had not even let her hug Maya, and that she didn't feel like it was ever going to end. And she was upset, and she just seemed so hopeless that anything would ever change.
Was she crying during the conversation?
Yes.
And I'm sensing you probably were too.
Indeed.
Okay.
Sorry.
It's all right. Have a drink of water if you've got something there. It's a difficult topic. So, during the conversation, tell us as much as you can recall about what Beata was saying.
She told me about the hearing and that it didn't go as she'd hoped. And that when Maya was leaving, she was crying and she wanted to hug her and she wasn't allowed to hug her. And that they wouldn't even let her touch her daughter. But they had no evidence that anything had ever been done. And that it didn't seem to matter what she did or how long they held her, that nothing was changing. And that she just didn't see a way that they would ever let Maya go.
Did she say that she saw any people or representatives from Johns Hopkins at that hearing?
She didn't mention them to me.
Okay. And then when and how did you find out that she had taken her own life?
In a parents group, another one that we both belong to, someone local to the Florida area posted about it.
Okay. And
That's how I found out.
And your reaction, I assume you've shown us, it's very upsetting. Okay.
Definitely, it's very upsetting. Sorry.
So, that's all right. That's all right. Keep drinking your water. You'll be all right. So after this, we're almost done. After this, were you or did you stay in touch with the Kowalskis at all?
Well, Jack had never really been in our group, so I didn't really have a contact for him. He and I did eventually talk a couple of times. We sent a bereavement card, obviously. But I honestly, losing Beata was really hard on me as a support person.
Mm-hmm. You felt she was a good friend?
I did. I felt like she was a good friend, and my role was to help, and I had not helped her.
And and what was your specialty again in teaching?
Special education.
So does that require in teaching special education kids that you develop a sense of how they are doing, perhaps without them even telling you?
Definitely. And I've been teaching primarily emotionally disturbed children and kiddos with autism for a long time. And so, yeah, it definitely is something that I felt like I should have been able to tell or to make some kind of judgment on.
Survivor guilt. We understand. So then, in this conversation, can you tell us whether Beata seemed to be, I don't want to use that analogy, really unable to go on?
She just seemed completely hopeless and just literally there was no hope and nothing was ever going to change. And if
look back at trial exhibit 2714. Does it state in there why Beata believed, what she believed the plan to be of Johns Hopkins insofar as her?
Judge, okay,
go ahead.
I guess I'll wait. It's just an improper question. She's asking her to comment on a document written by Beata Kowalski.
Sustained.
And whether or not it says something in it. I mean,
Sustained. Any other questions?
That's it.
Ms. Crowells, do you have any questions?
No, I don't have any questions, Judge, just argument.
Ms. Boland, what I'm going to do is I'm going to place you into the waiting room. We're going to have a conversation outside your presence for a few minutes, so please hang tight at your camera, but it's going to be a few minutes, okay?
Okay. Yes.
The transcript will reflect that Ms. Boland is out of the court's presence and is in the Zoom waiting room.
Plaintiffs move to admit trial exhibit 2781-006, trial exhibit 2781-012, trial exhibit 2781.
The numbers I had were 27816, 7, 12, 13, 14, and 15. Is there anything else?
Yes, no, Your Honor.
Well, first let me hear from Ms. Crowells your position as to those 6 documents.
Judge, they're hearsay. There are conversations she's having with Ms. Boland. They contain hearsay within hearsay. They talk about things her husband told her. They talk about things that she's describing her daughter who she hasn't seen. So she's clearly, the comment within the comment is hearsay, and then the comment, the actual document itself is hearsay. So I don't understand why any of these would come in. They're all hearsay.
What I'm going to ask, I'm going to change the feed. I don't know, Mr. Reyes, if you are able to post for me the 2781006. I'm going to need to do this one at a time. Unless, Madam Clerk, do you have them pulled out right now? Or
I've got the 3 of them if you want, Judge.
well, there's 6.
6 pages, yes, I've got them.
Maybe the fastest way is I just actually look at the actual official exhibit.
All right, it's published for you. 6. Yep. There's 6, Your Honor.
I should note for the record that we are not moving in, we would be open to redacting the blue parts which are not spoken by Beata Kowalski, but rather the recipient, in this case, the witness.
Judge, the first part is her warning Miss Boland to be careful at the hospital. Same here, Mag, be careful at the hospital. I'm sorry, are you waiting? And then it's just her telling her that they're being accused of Munchausen by proxy. I'm not aware of any hearsay exception this would apply to. It's her sharing information, warning the other person.
Do you have any argument about the 90.803 paren 3 then existing mental, emotional, or physical condition exception?
The only comment that would be possibly that is it's awful nightmare. That's her state of condition. The rest is factual information. It's not state of mind. And to put that in without, I don't think it qualifies. And it's not relevant with respect to what she's sharing with Ms. Boland. And her state of, yeah.
With respect to 2781-006 and 007, I agree with Ms. Crowells that the texts themselves do not qualify under 90.803 paren 3 exception. There's basically no reference to state of mind in this particular text, so those 2 will not come in.
Your Honor, I failed to cite a second basis that we have talked about before, and that is 804 paren 2 paren F, statement offered against party that wrongfully caused or acquiesced in the declarant's unavailability, and we would like to apply that to all three, but I'll move to the next one so we can keep
We
going.
look at it, but
I have some more.
804, what parentheses?
Paren 2, paren F, statement offered against party that wrongfully caused or acquiesced in the declarant's unavailability.
Well, even if that were to apply, it's not. How would you otherwise get it in?
Judge, I think that's like,
Because it's really not talking about any sort of state of mind. At least 6 and 7 isn't.
I understand, Judge, but it is a much similar to the catch-all in terms of breadth, the federal rule catch-all. And I'll tell the court that we have exhausted every research to look for case law to help you on this.
6 and 7 are out. 6 and 7 are not coming in.
Okay.
Let's look at the next series was 12 and 13, in fact.
Yes. We're moving to admit 281-012, 281-014.
did you mean 1-3 as well?
Yes, it's 12 and 13.
Judge, this is Mrs. Kowalski commenting about Maya. So it's not Maya commenting about her state of mind. It's somebody else commenting about Maya's state of mind and her condition. Does not qualify. It's not the speaker's state of mind.
I agree with respect to pages 12 and 13. They do not qualify under either of the exceptions that Mr. Anderson has proffered.
Well, I believe that since she's a minor, that the parents in this situation under the law can be her spokesperson. We don't necessarily have to worry about hearsay if she is, it's a statement by a child with physical, mental, emotional, or developmental age of 16 or less. And if the court finds that there is reliability, and it's for describing child abuse or neglect, sexual abuse, unlawful sex on or in the presence of the child. And in this instance, Judge, it would be as to the child being abused. And that obviously is our position in the case, and that because of this, there is a means under 803.23 to have that admitted.
Let me just remind you, we had a discussion about this the other day. You have not done the statutory prerequisite for child victim hearsay, and so that is not a basis I can consider at this point in time.
We're aware of it.
If you did it, then maybe we could talk about it. But with respect to pages 12 and 13, I mean, Ms. Quarles is right. A lot of this is just factual testimony. I mean, frankly, I think you're going to be able to get it from other witnesses anyway.
Likely, Your Honor.
Yeah.
This is more
So let's look at 14 and 15.
or less the predicate for the final questions. Yes, it's the same bases. And again, you would be the first court, if they appealed this, to have made law on this if it ever got that far, because we can't find anyone anywhere that's an appellate decision. Maybe the defense has. But that's as to the 804.2F. As to the 803.3, again, this is a statement of the present, and I made the predicate, state of mind of Beata Kowalski. And state of mind is more than simply statement of just...
Mr. Anderson, let me cut you off because I'm actually in your camp on pages 14 and 15. So let Ms. Crowell's, knowing that this text is materially different than the other texts. So I'll give you a chance to.
Thank you, Judge, because it's not state of mind, it's just her opinions about things that are going on. This is not this is her ranting, if you will, about what the doctors are doing, what the charges are, how good her lawyer is, whether or not Maya has a lawyer. These are factual things. This is not state of mind. This is not, I feel sick. This is, I think my lawyer's good. I wish I hired another one. Maya has an attorney. We hired an appellate attorney. These are factual statements about what they're doing. It's a conversation. It is not state of mind. I can't believe I worked so hard. I'm wasting all my money. This is not the typical state of mind type of comments, Judge, that the rule is meant to encompass. These are her telling her factual things about what's going on. That's not state of mind.
Well, I'm going to allow 14 and 15 under 90.803 paren 3, although the blue boxes on page 15 cannot come in, and the second, what can I do for Maya to get her care package? That would not qualify.
Awesome.
So are you able to redact it? And we need to make sure that the clerk's version contains those redactions.
Do we have the tech to do that? Yes, we do have the tech to do that.
Now,
Goodness.
so
Judge, can I ask you to reconsider part of the text on page 2781-015, where she's talking about going broke? We'll have to put our house up for sale. First of all, I think that violates the motion in limine with regard to financial considerations for either party that's been granted. I can't believe we worked so hard to waste all my money. This to me is a 9403 component that even if it's admissible under the hearsay exception, should not be admissible because of that.
I thought about that, but here's the thing, because we have this intentional infliction of emotional distress count where Beata's emotional and mental state is an element, is something that we really need to focus in on, and this is evidence that goes to it. I think it does qualify under 90.803 paren 3. So I think this text string, or just the physical text, not the string, just that one big text, is admissible, and I'm going to allow it. So I will deny the motion to reconsider. Now, was there anything else, Ms. Crowell's?
Yes, regarding the rest of her testimony and all of the conversations that she had with Ms. Kowalski, I don't believe that those should be admissible with respect to, it'd have to be very narrow if they're allowed in at all, because she was starting to get into comments that Mrs. Kowalski was making as opposed to her state of mind.
What I can tell you, Mr. Anderson, is I believe some of what she testified to is allowable, and it is closer to what Ms. Crowells is saying is the more traditional state of mind. I think, Ms. Crowells, unfortunately, you're going to be in the position of having to object contemporaneously, because I don't, as I was listening to her testimony, I don't think there's a way I can craft a bright line rule for what is and isn't admissible without a specific question being asked.
I also object to her any testimony regarding her son having CRPS, the ferocious fighters that he started, and her backstory regarding to that.
I'm okay with this witness's child has CRPS, and that the child had started a foundation or whatever it is, and then that's how they met up. But that's as far as you can go with it.
The package? Yeah, I can say
No,
the
care
package.
packages, no, we're not doing care packages.
Okay. It would just be,
It's just because it just
Communication.
explains how Beata found this witness.
with the permission of the court, when we call her formally before the jury, I will instruct her that I need her to answer my very specific questions, and I'll attempt to
And
do
that's fine. Ms. Cross, is there anything else?
I don't think so, Mitch.
Now, do you all want me to swear her in front of the jury with the same admonition, or do you want me to tell the jury that I have already sworn her?
In the interest of time, probably just tell them.
It's fine. Are
I'm
we
going
doing
to
this
bring
witness now?
in Ms. Boland back. Okay. Can you hear us, Ms. Boland? You're on mute right this second.
Yes, I can.
Okay. Mr. Anderson's going to give you a couple of statements. I need you to
Okay.
listen pretty closely to what he has to say.
Okay.
Ms. Boland, because of the rules of evidence, I have to craft my questions very tightly. So I'll ask you to just answer the question that I ask, and then I will do my best to bring out any more information that I think you're able to relate. Can we agree to do that?
Yes, sir.
Okay.
And also, ma'am, if there is an objection that's raised, please don't answer the question until I have ruled on it and say that you can answer it, okay?
Yes, sir.
Any questions about that before I bring in the jury?
No, sir.
Okay, and what I'm going to tell the jury is that I have already put you under oath and that your testimony is under oath, okay?
Yes, sir.
I have one question, Judge, but I can refresh recollection with 6, 7, and 12, 13.
I don't have a means to not have the jury see that. You've already gone through that with her.
Yes, I have.
So,
Yeah, I see your point.
yeah, let's bring in the jury.
She's available there, but should we do Dr. Spiegel?
No. Because of the logistics of this.
I hear you.
Okay, please be seated. Welcome back from lunch, members of the jury.
Thank you.
I want to confirm while you're away, you did not discuss this case amongst yourselves. You did no investigation. You did not receive any information. Is that correct?
Correct.
And I also want to confirm that since you were last with us, you were not approached by anyone about this case. Is that correct?
Correct.
And have, since you last were with us, have you seen any media coverage about this case? No. Okay. Now, our next witness is going to be by Zoom. On the screen in front of you, you should see the witness. Is there anyone that cannot see the witness? You all can see the witness?
Yes.
Okay. Members of the jury, before you came in, I have placed this witness under oath, and so she is under oath and will be testifying under that oath. Mr. Anderson.
Please state your name for the record.
My name is Megan Boland
And where do you live?
in Elizabeth City, North Carolina.
How long have you lived there?
A little over a year.
That's in North Carolina or Elizabethville?
In North Carolina.
Okay. And before that, where did you live?
Colorado.
Were you born there?
I was.
What do you do for a living?
I'm a special education teacher.
Tell the jury a little bit about first, tell the jury a little bit about the education necessary to become a special needs teacher.
I have a bachelor's degree in history and I had a minor in secondary education. And since then, I've taken a lot of postgraduate work to become a special education teacher. I'm licensed to teach 5 subjects in addition to special ed.
So there is a license for that in the
Yes.
state of North Carolina, and you are licensed.
Yes, in both Colorado and North Carolina.
All right. And for approximately how many years have you been doing that?
17.
Okay. How many kids in the class?
It varies depending on the year, but this year I have 25 on my caseload.
Do you have any children?
I do. I have a son who is 19 and a daughter who is 14.
And what is the son's name?
Patrick.
And what is the daughter's name?
Riley.
Now, do either of your children have special needs?
Both of them do. My son has CRPS and a number of other comorbidities, and my daughter has autism.
All right. And so, as a special education teacher, do you develop the ability to read your kids, for lack of a better term, your students, even if they're not telling you out loud or just by voice?
Objection, Your Honor.
Sustain. Let's
By
move along.
yes, by voice. Anyway,
You're not to answer that question, man. Wait for the next question.
Understood.
did there come a time? Well, hang on. How did you meet Beata Kowalski, either in person or otherwise?
I met Beata when she applied for membership in our support groups for ferocious fighters.
All right. And what did you do towards assisting her in follow-up to that meeting?
Objection, vague.
I'm trying to not...
Yeah, that one she can answer. You can answer that question.
Okay. I was able to give her membership into our parents group and help her get her daughter signed up to receive a care package from ferocious fighters.
And that group is a support group for CRPS victims and their parents?
It's a nonprofit that was started by my son that I have been running since 2014
All right.
that supports kids with CRPS.
So can you tell the jury about when you started corresponding with Beata Kowalski?
She sent a message to our board group in the spring of 2016.
And did there come a time when, and did you respond for the group?
I did. We started to talk, and so that I could get her set up with supports.
Okay. And the relationship, I don't know that you ever met Beata Kowalski in person.
No, when we took our road trip to Florida, they were unavailable to join us that day.
And so over the course of the rest of 2016, can you tell the jury how often you either corresponded with or spoke to Beata Kowalski?
She was an active member of our support community, and then she and I would message out like via Facebook, and also we talked on the phone probably 6 or 7 times over that year.
Just of interest, in those chat groups, are there various remedies or treatments for CRPS discussed?
Objection, Your Honor. Relevance.
That's a yes or no question. You can answer that question.
Yes.
So, again, about how many times would you say that you either spoke to her or corresponded by text?
We spoke probably 6 to 7 times, corresponded by text, probably 3 times that much, and then she was in the group.
So approximately, 18 to 21 times by text?
Yes.
All right. And so through the course of those 6 to 7 phone calls, were you able to, especially with your skill set, for lack of a better term, pick up on Beata's mood of the day or her how she was feeling, up or down?
I mean, we usually spoke for an extended period of time, and I could definitely tell if she was having a good day or a bad day.
Were
And
these a quick, hi, how are you? Did you get this? Or were these more in-depth, long conversations?
they were typically more in-depth, long conversations.
Did you learn a lot about her?
I learned a fair bit about her as a mom, not probably personally, but as a mom.
And so over the course of the rest of 2016, you continued the relationship up until January of 2017. Is that right?
That is correct.
All right. And I'm going to show you what's been marked into evidence as Trial Exhibit 2781-014, and it's a text. May we publish?
You may.
Same objection, Your Honor.
Okay, overruled.
Do you recognize this text?
Yes, I do.
Okay. And so how did you read this text in terms of purpose?
Objection, Your Honor. Speculation.
Okay, sustain that question. Wait for the next question.
In this, and in your phone conversations, leaving this aside, did Beata Kowalski indicate that she believed that she was being retaliated against?
Objection, Your Honor. Leading and
I'm going to overrule the leading. You can answer that question, ma'am.
Yes, she talked about it and wrote about it in this text message or in this Facebook message.
Did she explain why?
She had been
objection,
very
Your Honor. Hearsay as to any explanation.
Present state of mind.
Overruled. You can answer.
She was very upset by how Maya was treated when she was in the ICU and had voiced that she was planning to move forward with a complaint. And then all of a sudden there were these accusations and they took Maya away. So yes, she felt like they were retaliating.
So going back in her conversations, did she relate to you that she had been in contact with her daughter?
After they took her, after a while, Kyle and her dad were able to see Maya, but she had a lot of difficulty even getting her supervised phone calls set up.
And through either text or phone, were you able to learn that she was aware of Maya's status? Physically.
Objection. It would be based on hearsay.
That's
I'm going to sustain that. Wait for the next question, ma'am.
and over the phone in November, did she seem to be upset about her daughter for specific reasons? She
was very upset. Maya was not getting care according to what she said. And she was just being held there. And as a mom, there's nothing worse than knowing
Objection,
your
Your Honor, as to any opinions by the witness.
You've answered the question, ma'am. Let's wait for the next question.
Okay. So, did there come a time then on January 7th,
Can you
2017?
take this exhibit down?
Yes.
Next page, or?
Yes, well, maybe they should read the whole thing. Leave it, they can read it later. Did there come a time that you spoke with Beata Kowalski on January 7th, 2017, before she took her life?
I did speak with her after the hearing, and so I assume that makes me one of those people that spoke with her before she took her life. Yes.
You don't know of anyone else in particular that spoke to her?
No.
What was her state of mind at that point?
She was really upset.
Okay. More so than usual, obviously.
Definitely more so than usual.
Did she seem, from the tone of her voice and what you could discern from her, that she had given up hope, or was in the process of giving up hope?
She had given up hope. Absolutely.
From the conversation, did she express anything more about why she had reached the point of no hope?
She shared that Maya was crying in the hearing, and that she just wanted a hug, and they wouldn't let her even hug her daughter. Mm-hmm. And she's said that she didn't see a way that this would ever end, and that she just could not see a way to continue fighting, because no matter what she did, nothing helped Maya.
All right, I know this is difficult then. The record reflects she took her life sometime the evening of January 7th or early morning of the 8th. When was the first time that you heard that she had taken her life?
I don't know if it was that day or within the next day or two. I just saw a post in another parents group where someone local had heard about what happened.
How did that affect you?
Objection, Your Honor. Unfortunately, not relevant to how it affected her.
I'm going to allow the answer. You can answer, ma'am.
It was really hard.
Go ahead. You can answer.
I was in a position where I was there to support and to help parents, and I definitely felt like I failed to help her see that there was another way.
But you're not a psychologist or a psychiatrist, are you?
No, I'm not.
That's all right. And was she a good friend to you?
Yes, she was.
Your witness.
Ms. Burrows.
No questions, Your Honor.
Members of the jury, do any of you have a question for this witness? If so, go ahead and raise your hand. Okay, I don't see any. May this witness be excused at this time?
She may.
Okay. Ma'am, thank you for being here. I'm going to place you outside of the courtroom, okay?
Thank you.
And let's go to your next witness, please. Plaintiff.
Plaintiff's call, Dr. Alan Spiegel.
Stand here, face the clerk, and raise your right hand.
Do you solemnly swear or affirm the testimony you're about to give will be the truth, the whole truth, and nothing but the truth?
Yes. All right, come around this way. And now you can have a seat on the witness stand there. Okay.
Please state your name for the record.
Alan Mark Spiegel, MD,
Where do you live?
Palm Harbor, Florida,
How long have you lived there?
39 years.
Are you a lifelong Floridian or?
No, I'm a New Yorker by trade.
I don't think we found one yet.
Moved down here for better weather and better life.
Right. And what do you do for a living?
I'm a neurologist.
Now, give the jury the benefit of a little bit of your background, training, and experience towards where you are now, beginning with either undergrad or med school, whatever you're comfortable with.
Went to college, University of Vermont. Went to medical school, University of the East in the Philippines. Coming back to the United States, I did my internship at New Rochelle Hospital in New Rochelle, New York. I then did a residency in neurology at the State University of New York, Downstate Medical Center. From there, I moved down to Florida almost 39 years ago, and I've been practicing medicine locally in Palm Harbor since.
Now, can you tell the jury do you know a lot of anesthesiologists?
Yes.
Fair number. Can you tell the jury the difference in the approaches between a neurologist and an anesthesiologist? And I'm orienting you more towards treating disease rather than injury.
Neurologists do a lot of the workup in trying to find the causes of the disorder, doing a lot of the testing, doing a lot of the initial workup. Then we send them over to pain management to treat.
Okay. And that would be the anesthesiologist?
Anesthesiologist.
So is there a difference there in terms of the not only job, but kind of the view of how you get people better between the two?
Yes.
And so I want to talk to you a little bit about your experience with CRPS. And you have a unique treatment that you've come up with, or is it unique anymore?
Yeah, it's unique.
All right.
It's hyperbaric oxygen therapy.
And can you explain to the jury first your experience with CRPS, and then I want to get into the hyperbaric therapy.
In training in neurology, we're cognizant of certain disorders such as CRPS. It's a unique disorder, extremely hard to treat, extremely painful. There's no one clear, discernible method of treating. The disorder itself encompasses, I'm sure you've gone over this before, the symptoms that I look for personally are one of the hallmarks to me is something called dysesthesia, or they call it neuropathic pain. Another term is causalgic pain. Basically, what this is just exquisite pain, tenderness to light touch of the limb that's affected, or limbs that's affected. The simple touching with just your finger lightly while eliciting no real firm impact on the area can elicit severe pain that lasts well after the stimuli touching has resolved.
And is this a periodic? Does it change day to day? This type of this symptom?
It can vary from time to time.
Okay. Let's talk a little bit more about the HBOT, the hyperbaric. Tell the jury how it came about that you developed this treatment.
Okay, first explain what hyperbaric therapy is.
You sure can.
Okay. You and I are breathing room air, which is 21% oxygen. When you're doing hyperbaric therapy, you're lying on a bed, enclosed in clear glass, breathing 100% oxygen under increased pressure. That causes your body to be saturated with 8 to 10 times more oxygen you currently have now. That turns oxygen into a drug. Oxygen is a drug to several things. Number one, causes new blood vessels to grow into any part of the body, not getting good blood perfusion, reduces swelling, inflammation, improves the immune system, makes your body release 8 times more stem cells from your bone marrow and fat stores to be released throughout the course of the treatment and day. It also makes the white blood cells search out bacteria, viruses, toxins, move after the body as well. It's a treatment that's performed 20,000 times per day, if not more, in the hospitals across the United States. It's an FDA-approved treatment that has 15 FDA-approved diagnoses, including non-healing wounds, diabetic wounds, crush injuries, bone infections that are not healing by antibiotics. It's also used in people who have had cancer and got treated with radiation therapy And when you treat treat the cancer with radiation therapy, you're also reducing the blood supply to the healthy tissue around the tumor. So that area gets what's sometimes called radiation necrosis, decreased blood perfusion to the healthy tissue. So what hyperbaric therapy does, it causes new blood vessels to go into those areas to make it survive and heal. Other methods, other uses of hyperbaric therapy, acute vision loss, acute hearing loss. If I see them within 24, 40 hours, many times I can bring that vision back. I said crush injuries, I believe, carbon monoxide poisoning, and there's a few others, but roughly it's 15 different diagnoses.
So how did it come about you discovered that it works on CRPS, or it makes the symptoms better for CRPS?
That was clearly anecdotal. I was treating a patient that had a very bad wound in the leg, and that's usually a 40-session treatment where we have a wound care specialist who's attending to the wound itself, debriding it, but because of poor circulation and poor nutrition to the wound itself, it's not healing. They send with hyperbaric, which, as I said a moment ago, does a couple of things here. It increases circulation, it reduces swelling inflammation, and therefore improves antibiotics going to the area of non-healing wound. So I was treating a gentleman with this kind of a problem. And at the end of treatment, the wound healed very nicely, and they turned to me and said, by the way, my CRPS is gone. I had it in my arm, it's gone. And I saw it, if it's coincidental. Didn't think much of it. I said, well, that's interesting. Until about 6 months later, I had another patient, a woman who had another wound in her leg, who was being treated with hyperbaric therapy for 40 sessions. And at the end of treatment, she said, oh, by the way, my CRPS in my arm went away. At that point, that's kind of interesting. So I called up some of the patients that I had initially seen. See, let me back up a second. As a neurologist, we were taught that the first thing you do when you feel someone has CRPS is you value them, then you send them to the pain management physicians to manage the care thereafter. So I contacted a lot of patients I had sent to some local experts in CRPS, and I said, by the way, are you having, how are you doing? And there was,
Respectfully, we just.
excuse me?
We have a long narrative here, not responsive.
Yeah, why don't we wait for a question and then you can answer
Okay.
that? How
What
about
was the next event that caused you to believe that hyperbaric therapy would work on CRPS?
There was a second patient, same story, same non-healing wound, same response after 40 sessions of hyperbaric therapy.
And then who did you call, I guess, to find more potential candidates?
My own patients. The patients I had originally seen, diagnosed, and sent off to pain management for treatment.
Did any of them come back in?
Yes, I probably saw about 4 or 5.
Okay. Now, in terms of hyperbaric is a very broad range, it sounds like, but in terms of adults versus kids, does it work equally well?
Yes.
Is there any particular difference in terms of the therapy, leaving aside the psychological kids wanting to do that, but is it pretty much the same treatment for an adult with hyperbaric, for a child with hyperbaric?
Yes.
So how did you first meet the Kowalskis?
I got a call, I think, from Mr. Kowalski. He had evidently done some research, he and his wife done some research looking for other methods of treating CRPS.
And you began with that to take a history of what had gone on with them?
Yes.
And during this history, did they express to you that they were looking for new or substitute therapies for the ketamine treatments that they'd been using?
Object to the leading, please.
sustain?
What, if any, concerns or options were they pursuing?
They're looking for non-pharmaceutical methods of treating CRPS if possible. And they somehow came across hyperbaric therapy as one of the potential options.
So Tell us about the treatment itself. Now, there were some 40 treatments over the course of one summer?
It's 5 treatments per week, for this one of being 8 weeks.
8 weeks. And why is it necessary to do them so close together?
It's important because you are reinforcing, number one, the oxygen saturation, and the mechanism by hyperbaric therapy works by changing neurochemical changes in the body and promoting the decrease in swelling inflammation that hyperbaric comedy does.
During the time you were taking the history, did the Kowalskis, either Jack or Beata, quiz you about its safety and efficacy?
Yes.
And what do they want to know?
You want to know if there's any side effects to this treatment, if there's any contraindications, so there's reasons why someone should not undergo this treatment, the potential for improvement, the potential for failure of improvement, etc.
And were they interested in this conversations, the advantage of not having to worry about drug interactions or putting more stuff in the child's body?
Absolutely.
All right, so what was your impression? Well, I take that back. Did it come a time that you actually met the Kowalskis?
Yes.
And was this during the summer of 2016?
I believe the first visit was on May the 13th, and I think again on the 16th.
And we'll have your records in evidence. I believe they are, but we'll try to do that a little faster. Now, what was your impression of first Beata and Jack Kowalski, the parents?
Concerned, parents, loving, concerned, wanting to do whatever they could to help reduce the chronic pain the daughter was in.
And they were they exhibiting any behaviors that you would find troublesome to the point where you would think there was something dysfunctional with this family?
If I or my wife had a child, one of our 3 children with severe pain such as this,
Judge,
we would have done anything we could to avoid.
Hold on a second, sir. So I'm going to sustain the objection.
Were they appropriate? Did they communicate effectively with you without offense?
Yes.
So you explained this to them, you've testified, and did you perform an examination on Maya?
I did.
Tell the jury what you went through and why.
Went through just a general physical exam, then to look at the different parts of the body. Head and neck were unremarkable. Cranial nerves were unremarkable evaluations. When it came to evaluate the extremities, Maya had good strength in both arms and hands, but it was difficult to assess the legs. She had weakness in the legs, but it's hard to assess weakness in someone with severe pain to light touch. The way we evaluate people in neurology is in order to test muscle strength, you have to ask them to resist you to some degree while you're pulling against each muscle joint. You couldn't touch her. Like touch her legs, she screamed in pain. So whatever had to be done as gingerly as possible. And so it's difficult to 100% test the strength in the legs, but you could see that they had been atrophied and they were non-mobile.
And so over the course of your treatment, did it come to your attention that Maya exhibited to you some of the more classic symptoms or signs of CRPS?
Yes.
Did she present in a wheelchair?
Yes.
What, if any, dystonia did you see?
Her feet were turned inward. I didn't know whether that was because of plain weakness or was because of the severity of the pain that she was in.
And did you observe any lesions? Although she's clothed, but did you see any lesions?
I did not see any lesions.
All right. What other? So you've got sensitive to the touch. and the dystonia. Any other symptoms that you saw? Did you see swelling?
No, I did not see swelling. I didn't see some of the color change that sometimes occur.
Were those explained to you that they had happened in the history?
In the history from the parents, they informed me that in the past, besides the severe pain to light touch, the weakness in the extremities, there was change in color, change in temperature of the extremities. I don't know if they're swelling. I think perhaps they may have been swelling, but I can't recall 100% of that.
Now tell the jury whether if it's your practice to first conduct an examination, an independent examination, before you read all of what other doctors think or after.
I do my evaluation first.
And why is that?
I want an independent evaluation of what's going on and what's there.
And to you, were you able to either confirm or support a diagnosis of CRPS based on the combination of symptoms you did see and a history?
Yes.
Now, are you treating any unusual cases right now?
I'm treating a 2.5-year-old baby, a 2.5-year-old child who's near drowning. The hospital told them because she was near brain dead to shut off all treatment, and the parents chose not to do that. And she's now moving. And
Sir, sustain that objection.
Predicate. You sustained it. I get it.
Sustain the objection.
Guys got to try. All right. So have you had success with this, with hyperbaric treatment?
yes,
Tell the jury about the statistics on how well you've done overall with all different presentations for hyperbaric treatment.
I've treated over the last 25 years approximately 500 patients with CRPS using hyperbaric therapy. I'll say that 75% of the population that I treat have an excellent response, another 15% have a good response, and 10% not as much response as we like. Now you have to understand when excellent response means reducing the pain to a point that's either gone or it's at such a lower level that's tolerable. These people come in with a level of pain 10 out of 10 many times. If they leave 1 or 2 out of 10, that's a success.
And how many of these patients do you estimate were CRPS patients?
These are all CRPS.
And how many again?
500.
Okay. Has this treatment now become, you said it 20,000 times a day it's used regularly in hospitals, but specific to your use, has the treatment been adopted by others? Are other people doing it?
For CRPS?
I don't know, for anything.
Oh, sure. Sure, it's an FDA-approved modality, but there's a lot of non-traditional uses for it. In every other country in the world, it's approved about 75 different diagnoses.
And is it completely safe?
Yes.
All right. Did Johns Hopkins All Children's Hospital contact you in October of 2016 to discuss with you any suspicions?
I got a phone call from someone, I don't recall who, and I didn't make a note in my chart.
Then we don't have to talk about it. Okay. Now, did you personally, from your treatment before, after, or during, have any suspicions of conversion disorder as to Maya or Munchausen by proxy by the parents?
No.
Now, do you work with any anesthesiologists specifically?
I work with many of them.
And are there some specialists out there in this area that you regularly refer to?
There's 2 in the area who they're in close proximity to my office, and I've used them over the years. One is Dr. Kirkpatrick, and the other is Dr. Hanna.
And they use ketamine treatments. Are you? Now, between a neurologist and an anesthesiologist in the area of pain control using ketamine, which type of medicine is going to know more?
Would be anesthesiologist or pain management doctor. I may use it interchangeably, I'm sorry.
Okay. So although neurologists might have some knowledge of it, they gained over reading that they don't regularly work with ketamine or infusions.
Leading, Your Honor.
What if any systematic use of ketamine do neurologists make?
Rare, if any.
All right, so tell us about how Maya did through the course of this.
She was receiving the hyperbaric therapy from us. She was seeing Dr. Hannah for treatment, and also getting physical therapy through them. She did see our physical therapist a couple of times near the end, and he even noticed that she had some improvement with us actually getting down on the floor on her knees and being able to do things which she was not able to do beforehand.
So she showed some increase in muscle?
Yes.
And did the patient report that it helped? Or first, did the patient report to you that it seemed to help with the pain or did help with the pain?
I believe she said it did help to some extent. Her father intimated that that he had even noticed, number one, decreased pain. He knows that she was able to transfer from bed to chair to wheelchair and back, etc., much easier without the evidence of as much pain.
Is this covered, though, by medical insurance?
It's covered for the 15 different diagnoses I mentioned earlier, not for CRPS.
So this would be an out-of-pocket expense for that?
Out-of-pocket expense.
A moment. Get in more. Nah, we'll see it back there. Your witness.
Please, the court.
You may.
Hey, good afternoon, doctor.
How are you?
I'm doing well. Thanks for asking. You're not board certified in neurology.
No.
Okay. 99.9% of your practice is adults.
Yeah, pretty close to that.
Okay. You do not use ketamine for CRPS, true?
I don't use ketamine at all.
Okay. Because you believe ketamine should be used in a supervised environment that you can't provide. Is that fair?
No, because there's many medications I don't prescribe.
Okay.
It's a lot of the narcotics that the pain management and anesthesia they use routinely, and I choose not to use them because I believe it's better in the hands of people who use it all the time.
You said the diagnosis of CRPS is typically first made by a neurologist, right?
I won't say solely, but it's commonly, yes.
Okay. You did not diagnose CRPS. You relied on the outside providers to make that diagnosis, true?
I made the diagnosis based on my exam findings, along with the history of what I received from the patient's family.
Okay. The patient came to you with the diagnosis of CRPS, isn't that true?
Yes.
Okay. Let me ask you about, you said you referred to Dr. Kirkpatrick. You haven't referred a patient to him in over 12 years, have you?
In the last 12 years?
Right.
No, in the prior 12 years I did that.
Right, but in the last decade plus, you haven't referred a single patient to him, have you?
Probably not, because I found hyperbaric therapy to be more efficacious.
You don't refer patients for ketamine comas.
No, it's outside my wheelhouse.
Okay. And you don't, in this case, your work was not referred by Dr. Wassner. You weren't retained by the family from a referral from her doctor, were you?
No.
Okay. Hyperbaric oxygen therapy is not FDA approved for CRPS.
Correct.
Okay. Let me talk to you a little bit about your treatment. And these records are in evidence, so I'll ask to start with Joint Exhibit 1052, 13, please. This is, well, can you identify what this is for the jury, please, doctor?
Excuse me?
Can you identify for me what this is?
This looks like a form that we have patient's family fill out.
Okay, and so this, and we'll enlarge some of this, but this is what the parents of Maya would fill out for you in terms of history. Is that true?
These are, we call a review of systems, not just what was there that day, but what could have been there in the past.
Okay. Doctor, you would see that the parents on behalf of Maya checked that the review of systems was headaches, correct?
Yes.
And then on the right side of the column, there was no cough, correct? At the top, respiratory.
Correct.
And then they checked rash, which was eczema, correct?
Correct.
That's a skin condition that can cause lesions, correct?
Correct.
They also checked under the gastrointestinal, if you go down, Clay, the positives were loss of appetite, constipation, sometime abdominal pain. Is that correct?
Correct.
And then under the nervous system, there was the trouble sleeping, and then you see the weakness, numbness with pain with walking. Is that right?
Yes. Okay.
So it looks like you did your own hands-on evaluation. I'll show you that note just so you're not guessing, doctor. It's at 1052-16. And I'm going to ask you about, this would be the first time that you would have evaluated Maya, correct?
Correct.
You recorded in the second sentence that she presented, but the first consultation was cut short due to Maya's inability to be examined because she was in extreme pain, but when she came back with her dad, she could tolerate the exam. Is that right?
She tolerated the exam. She still could not be touched in the extremities that were involved.
Her pain levels were different when she was with her mom versus when she was with her dad.
No.
That's what you wrote.
That's what's insinuated, but that's not the case. She did have the same pain. Just that you have to understand with CRPS, there's flare-ups on and off throughout the course of a day, week, month. You could have periods of time where there's minimal discomfort, and then the simplest change in environment and things that are going on in one's life can make something flare up.
Just so I understand how this worked, when Maya presented with her mother, you had to cut it short because of her extreme pain. When she presented with her father, you were able to complete your exam. Isn't that true?
Well, in this particular case, yes, I was able to complete the exam, but she was in severe pain when I first saw her the first day, yes.
You wrote about halfway down, she had whole body pain and was a vegetable in bed due to severe pain. Where did you get that from?
From her father.
Let me talk to you about your exam, which is on the next page. You did your own physical exam of the patient, is that right?
Yes.
And as a neurologist, you're looking for signs and symptoms of CRPS, true?
Correct.
Okay. There's no dystonia listed in your chart.
No.
You didn't chart dystonia?
No, I didn't.
Okay. Under the section for lungs, you wrote the lungs have clear breath sounds without rales or rhonchi. There's no signs of asthma at this visit, is there?
No, this visit, no.
Okay. You put under the abdomen is flat and non-tender. That means you were able to push on her stomach?
Yeah, to be honest with you, I didn't go into as much depth with examining a child, which is not my forte. As you know, I'm an adult neurologist, and I'm not a pediatrician. So this is part of my standard template, so to speak. And in a template, that's the way it was. Is I did not formally examine the abdomen, even though it says that I'm an adult neurologist. I don't put hands on children, abdomen, and other areas, particularly when they come for an evaluation in the extremities.
Okay. You did look at her extremities.
Yes.
Okay. And you specifically noted at this appointment, no change in temperature or color of the skin, correct?
Correct.
Okay. So at the appointment where you did the assessment, no dystonia, no change in temperature, no color of the skin. And the next sentence says there's no change in the nail bed either. Is that right?
Correct.
All right. The rest of the exam, actually, we'll go to the next page. It looks like at the bottom you discussed with them that this is not an FDA-approved treatment. Is that right?
Yes.
Okay. So let me ask you about some more information that you got from the Kowalskis. It's at Joint Exhibit 1052/42. Do you recognize this?
Yes.
What is it?
It's a list of medication that she has been prescribed in the past.
Okay. You had asked your patient to bring you a list of current and active medications, right?
Yes.
Okay. These were the list that was provided by the Kowalskis to you about the medications that she was either actively taking or taking as needed. Is that right?
Yes.
Okay. If you'll go to, let me ask you, did you prescribe any of these?
None.
Did you refill any of these?
None.
Let me ask you about the next page, 43, the medication list goes on. Any of these medications, did you prescribe any of these?
No.
Okay. You talked about the hyperbaric therapy. I think you said there were 41 sessions, is that right?
They said 40, but
Okay,
either way.
got it. Was she able to tolerate them all?
Yes.
Okay. There was no point from the increased pressure in the machine that she said that she had to stop. Is that
You don't feel pressure of being treated with hyperbaric.
Okay.
The only pressure you ever feel is in your ears. You go up in an airplane and the plane ascends or descends, you feel pressure in your ears, and you clear your ears by yawning, swallowing, pinching your nose, trying to exhale. It's identically the same feeling. So once you clear your ears, you have absolutely no bearing that you're under pressure, much like when you're on an airplane.
Right. I guess my question is, they're lying in the machine for, is it 90 minutes each time?
Yes.
And at least going through your records, I'm not going to walk you through them all, I promise you. But looking at them, I didn't see any that had to be cut short.
I don't believe so.
Okay. You talked a little bit about the response to therapy. It's actually true. You talked about 3 categories. 75% of patients have this great result. 10 to 15% have a so-so result. And about 10% of your patients have a result that you'd say is not really ideal. Was that sort of what we understood?
Yes.
Maya was in the last category, wasn't
Excuse me?
Maya was in the last category, wasn't she?
I was hoping she would do better than she did. Normally what I have people do is do 40 sessions, take a break. After you do hyperbaric for 40 sessions in a row, you need to take a break. Your body needs time to what we call off gas. So you need time, like 2, 3 weeks, 4 weeks, for the body to not be under oxygen, under pressure, and then you can do more. At that point, I would have had her work with my physical therapist. My physical therapist in my office works with all my RSD patients, CRPS patients.
Did you recommend her to any of your physical therapists?
I wouldn't, because she was currently under the care of Dr. Hannah, and she's being seen by the physical therapist at Florida Spine.
Do you know how often?
I don't know how often, but when we speak to patients and we ask patient and family, we have therapy here, would you like to do here or elsewhere? If they choose to do elsewhere, that's fine, and that was the case. Had she gone on and done more, we would have been happy to then add physical therapy with hyperbaric, which is actually a significant benefit, because when you do physical therapy on someone's CRPS, you are flaring up the pain and the discomfort of the treatment, and immediately after you put them in hyperbaric, it makes it go away. So we were able to build on that. But in this particular case, since she was already in the care of their physical therapist, I did not want to intervene.
But to go back to my first question, under the three categories of people who had a great response, those who had an average response, and those who had a sub-ideal response, Maya was in the last category, true?
She didn't do as well as I liked. Okay.
Let me ask you about, you brought her back for an evaluation after you completed the 40 treatments. You recall that?
Yes.
Okay. I'll show you that record, doctor. It's at Joint Exhibit 1052-75. And again, let me ask you about your general examination under vital signs. Well, just the general examination section.
Examination was unremarkable.
Unremarkable means normal.
Normal. Let me also mention, temperature is something that, when I say there's no asymmetry of temperature, and in my practice, when I take the temperature, I use my hands. Like if you had a child who you wouldn't have a fever, you put the back of your hand against the forehead and see if they have a fever. I use my hands to see if there's any asymmetry from left to right, etc. The pain management people, they have instruments that can tell exactly what the temperature is. So their answer as to what is present, what's not present, is far more valuable than mine.
Okay, I'm not trying to quibble with you, but you're a neurologist trained to spot signs and symptoms of CRPS, and one of them is a temperature change. At this visit, you specifically documented no change in temperature or color of the skin, right?
Right, to my hand, not due to instrumentation.
Okay. Let me ask you about the last page, which is 1052-76, please. You wrote in your plan, you talked about, you actually recommended after these 40 sessions holding off on further hyperbaric therapy, didn't you?
And seeing her back in a month, yes.
Because you believed with more physical therapy, she could do better and start walking, correct?
With physical therapy and additional hyperbaric therapy, I felt she could do better, yes.
Okay. You specifically said that with those combinations, specifically your therapy, physical therapy, you thought that Maya would be able to get up walking again, true?
I felt she would improve on the status that she was.
Okay. Well, you specifically said she will be able to ambulate.
I said, let's see, let me read this over. Yes, I did say that.
Okay.
I guess I did have a better feeling that there's a good chance for further improvement, given the fact that she did have some improvement in the number of sessions she did have from us.
And in fairness, doctor, you haven't seen Maya since this appointment of July 19th, 2016, have you?
No.
In terms of what her actual function is today, do you know?
No.
Okay. And your testimony today here, are you being paid by Mr. Anderson?
I'm being paid for my loss of income from my office fit today.
Right, but Mr. Anderson's paying you for that, is that right?
I guess so.
Okay. One moment, Your Honor. Nothing further, Your Honor. Thank you, Doctor.
Dr. Anderson, once you make your diagnosis, you don't continue to examine your patient to try to find reasons why your initial impression is wrong, do you?
No.
So after the first visit and you had examined Maya and made your conclusions, it wasn't like every day you came in and had another physical exam for this child. Would that be the situation? And so you didn't try to prove.
I object to the leading, Your Honor.
Just trying to save time.
Sustain the objection.
So did you become aware that there was a reason why they couldn't come back in the fall of 2016?
Yes, I understand that Maya had some abdominal discomfort, went to Old Children's Hospital, and no treatment was given from then for a period of time thereafter. I don't know all the circumstances except what's hearsay.
Okay. When you say in your records that you want her to ambulate, or you believe she will ambulate, these are aspirations, are they not?
Yes.
So we're all hoping, everyone would hope, to find a remedy or cure for CRPS in some way.
Yes.
Thus far, no one's found a cure for
Got to the
CRPS.
meeting, Your Honor.
What, if any, cure is there out there for CRPS?
Unfortunately, there is none.
Thank you.
Anything else, Mr. Shapiro?
No, thank you, Your Honor.
Members of the jury? Come on down with questions. Okay, Doctor, there are several questions from the jury. What ailments was the hyperbaric chamber originally designed to treat, and what year?
I mentioned them earlier, which is non-healing wounds, diabetic wounds, crush injuries, carbon monoxide poisoning, radiation damage to healthy tissue, those goes back to like the 1970s. Okay, more recently, in the last 5 years, they added sudden hearing loss and sudden vision loss. Those added, but the hyperbaric therapy goes back at least to the 70s. And if you really want to look at hyperbaric therapy in its origin, it's probably 100 years old. It's the best kept secret in medicine. There is no best. There is this. It treats so many different things. Just the FDA makes the determination what they want to approve and what they won't approve. We're treating military with traumatic brain injury for Iraq and Afghanistan. I've treated 20 of these people. I've treated one that had an ID blast blow up the front third of his brain, and he was hemiplegic, could not move one side of the body for 5 years, and he's now walking and talking. So,
Okay, so let's not talk
Okay.
about specific
okay,
other
I'm
cases.
sorry. Okay, needless to say, it's probably the best kept secret in medicine because Big Pharma doesn't have his hands in it. Okay.
Well, I think you've already answered this next one. I'm going to ask it, but see if there's anything further you need to add. 15 FDA approved uses. I'm assuming as time has passed, more uses were discovered and added to the original approved treatment. Please name a few added.
I just did that a second ago.
Are you able to name current uses for hyperbaric treatment that are not yet FDA approved?
Sure. That's what I do all day long. Traumatic brain injury, post-concussion syndrome, stroke, Lyme disease, neuropathy, let's see what I'm seeing, anoxic brain injury, like mentioned with the baby. I've treated newborn babies with anoxic brain injury also. They've done phenomenally well. Trying to think some of those we do treat. Parkinson's if it's early. Just say, mention a few.
Next question. During your exam, you noted her, and it's Maya's, reflexes to be hypoactive. Can you explain that to the jury?
When you go to your doctor and he takes a little rubber hammer out and they tap on your knee and you want to see it jump, okay, there was no reaction there. And that's part of the nerve issues that are going on. As well as, to be honest with you, I really couldn't tap too hard because she was in such pain anyway. So I did it gingerly. Otherwise, she would have been in excruciating pain.
Is that a symptom of CRPS?
Not in itself, no.
How much do you charge for each treatment?
I charge $200 per session. If you go to Morton Plant Hospital, which is in the Bay Care system, and you say you want a treatment for a non-covered service, they charge $1,900 for the same treatment, identical, same equipment, same everything. So we charge $200 versus their $1,900 for one session.
How many children have you treated with hyperbaric treatments for CRPS?
Probably around 20, 25.
And the balance of the questions have either already been asked or I cannot ask. Plaintiffs, any follow-up questions?
I don't believe so.
Defense, any follow-up questions?
None, Your Honor, thank you.
May this witness be excused.
Please.
Yes, Your Honor.
Oh, I should have asked jury, any other questions based on the answers you heard? Okay, doctor, thank you very much. Members of the jury, I think this is going to be a good time for a mid-afternoon break. Let's try to keep.
Any more witnesses?
Well, It's a unanimous decision. We're all going to make you sit here for an hour and 55 minutes before you get to go home. Seriously, thank you for being here this today and this week. I'm going to be releasing you in just a couple of moments for the weekend. Remember that we will be back on Monday next week. It's going to be Monday through Thursday for the jury. I again stress that you're not to discuss this case amongst yourselves. Do not do any investigation, receive no information. Don't review any media reports about the case. And obviously, if anyone attempts to approach you, you need to let me know by letting the court deputy know. So with that, have a wonderful weekend, and we'll see you on Monday. Do the math here real quick, because I know you're going to ask. Okay. The plaintiffs used 2 hours, 20 minutes. The defendants used 1 hour and 15 minutes. The plaintiff's cumulative total is 12 hours, 35 minutes. The defense cumulative total is 4 hours, 40 minutes. I know we didn't go all the way today, but let's make sure in the next 4 days that we try to use as much of the time as we possibly can during the school day here. Are there other issues we need to address? Mr. Whitney.
First issue is deposition designations. I believe we're waiting on a rulings from the court, and I know it's a lot of work, for Catherine Beatty's deposition, who I think was submitted in the first round.
I thought I had done all of round 1 and all of round 2.
I don't recall seeing Ms. Beatty's, the rulings on Ms. Beatty's testimony.
I don't recall seeing a sheet with Miss Beatty, so if someone...
Do you want us to resubmit it, Judge?
Please, because I don't think I've seen Miss Beatty's at all.
All right.
Okay.
And then we're doing our best.
If we can do that, hopefully in the next 30 minutes, and I'm looking at the folks who probably will be doing it.
Yeah.
We have to
We'll
make
get
sure
it to
you
you in the
have
next
the
30 minutes.
objections.
We'll resubmit.
Okay.
And I'll check with you. We'll work it out. Second is we have prepared the video deposition of Dr. Anthony Napolitano. And there's an objection that Ms. Crawls wanted, or Mr. Hunter wanted to address about playing that after it's been prepared.
There was an error made when we submitted the objections, Judge. With respect to Ms. Crane and Dr. Napolitano, there was supposed to have been a general objection to the effect that neither of them were testifying as a learned witness and did not qualify under the rules, since there would be a territorial reach of the rule. It was not included in the objection through Scrivener's error, but you ruled on the objections, you just didn't rule on that because we left it off. And we would assert that objection at this time.
And what did I think for the nurse who was acting in an administrative capacity but not as a nurse, I think I said that person was not under the skilled witness.
Yes, sir. That's correct, Your Honor. And I think you made the same determination with respect to Dr. Perno. And the intent here was that Dr. Perno, Dr. Napolitano, and Ms. Crane all fell in that bucket, and we didn't fill the bucket.
So you want me to spend all the time ruling on all the objections and then say that, never mind? It's okay. Mr. Whitney or Anderson, I mean, consistent, I mean, I try to be consistent, and so.
We'd ask the court to consider Florida Rule of Civil Procedure 1.330, the deposition of a party or anyone who at the time of taking deposition was an officer, director, managing agent, or person designated under 1.310, (b), or A of that, to testify on behalf of a public or private corporation, a partnership, or association, or a governmental agency that is a party to be used by adverse party for any purpose. And so, since Dr. Pernow is the chief of either pediatric medicine or chief of medicine, he is management level, he is a party, because he is part of the management of Johns Hopkins All Children's Hospital. And under the rule, we can use the deposition at any time for any purpose.
When was he or is he the chief?
Dr. Napolitano and Dr. Perna have both appeared here as corporate representatives. Doc, to answer your direct question, during the relevant time, 2016, 2017, Dr. Napolitano was the chair of pediatrics, and I believe Dr. Perna's position, I may get the phrasing wrong, was the chief of the medical staff.
Doctor, the statement of their positions is correct, Your Honor. Neither was testifying as such in the depositions that are at issue. These depositions were ordered by the court because these gentlemen were on the risk management committee. That's why they were deposed. So they weren't testifying in any corporate capacity. They weren't testifying as corporate representatives, nor were they testifying as learned witnesses. With respect to Ms. Crane, she was an ex-employee at the time of her deposition. So none of that applies.
She was general counsel at the time of Maya Kowalski's admission to Johns Hopkins.
The rule respectfully is at the time of the deposition.
Was that 1330?
Yes, 1.330, according to.
I think designated as such. I don't read it that way.
Well, with respect to Ms. Crane, Mr. Hunter's correct. The text of the rule is at the time of the taking of the deposition. And at the time, Ms. Crane was not employed by or affiliated with Johns Hopkins All Children's Hospital. Is that a correct statement?
Yes, sir.
So, Ms. Crane, assuming that she is not otherwise unavailable under the rule, she would have to come live. And I forget, where does she live?
All these folks live in either in St. Pete or
within the 100 miles?
Yes, sir.
Okay. So, unless the parties agree, Ms. Crane would have to come live. Now, with respect to the other two doctors, at the time they seemed to, director of pediatrics, director of the clinical staff, is that their titles?
One was chief of staff, one was chief of pediatrics. Those are medical staff positions, not positions within the hospital hierarchy. So there's a distinction to be made between a hospital director or a hospital officer and an officer of the medical staff.
They've both been in the courtroom as corporate representatives in this trial.
And the second DCA has a lot to say on that, and what they consider management is well below in power these two.
I'm going to find that they're sufficiently high, especially since they have been physically here and designated as corporate representatives of Johns Hopkins All Children's Hospital. So their depositions would be able to be used by the plaintiffs if they so desired.
Last thing on depositions for the moment, Your Honor. We have submitted, everyone's been busy, we've submitted our third round of depositions to defense. Ms. Crawls has promised to work diligently on those. My only request is that when they are submitted, which we hope to be in the next day or two, that rather than the court ruling on both plaintiffs' and defendants' submissions at the same time, that ours be prioritized, because I think we're reaching, hopefully we're 50% of the way through our case, so.
Okay, well, send them, because I mean, once I can have time to do it, I'll try to do it.
All I'm asking, Your Honor, is that if you would be willing to prioritize our depositions over theirs, because theirs are not going to be used for several weeks.
I'll see how it looks when I see what it is. Now, I honestly, I don't think I've ever seen Miss Beatty's designation, so.
You're about to.
We'll be looking for the memo by noon tomorrow.
That's the idea.
And then on
Monday.
the end of the day, midnight. You don't have to go wait until midnight to.
I've talked to Mr. Altenburg, Judge, but I doubt he's going to complete
I'll
that.
get it to you as soon as I can after I get the memo from them.
I understand. Anything else?
Not that we can say, Judge.
I see you got your bag already on your
Oh,
shoulders.
yeah, I'm out of here. Friday.
Not before the judge.
I'll be here. Anyway, have a good day, everybody. We'll be in recess. 8:30 on Monday.